This is Nadisha in Chicago, and you're watching your channel Knowledge for Quality of Life. Friends, we have looked at in the past various adverse health outcomes due to vitamin D deficiency. Today, I'll be looking quickly and share a few thoughts on the various health outcomes of a baby who's not even born yet. What are the things which scientific literature points out to? How it's related to mom's vitamin D deficiency status during the pregnancy. So let me share without wasting any time my screen. So what you see here is vitamin D deficiency during pregnancy can lead to various adverse outcomes for both mother and the baby. These include increased risk of preeclampsia, gestational diabetes, preterm birth, low birth weight, and neonatal hypocalcemia. Additionally, deficiency can impact fetal development and increase the risk of certain conditions in childhood, such as attention deficit hyperactivity disorder, which we call ADHD, and autism spectrum disorder, which we call ASD. Now, if you go to this bar link and you can read the paper here, which I'll be including in the description as well. So this is great. This is a National Institute of Health, very authentic source, and you can read it. Various papers and documented with scientific literature and citations. So adverse pregnancy outcomes associated with vitamin D deficiency. First is preeclampsia. Low vitamin D levels have been linked to an increased risk of preeclampsia, a condition characterized by high blood pressure and protein in the urine during pregnancy. So this is for mom, basically. And gestational diabetes is also related to vitamin D deficiency, which may increase the developing gestational diabetes, a temporary form of diabetes that occurs during pregnancy. Preterm birth, uh, this there is evidence suggesting that vitamin D deficiency can increase the likelihood of preterm birth, which is birth before 37 weeks of gestation. Low birth weight, babies born to mothers with low vitamin D levels may have higher chance of being born with low birth weight, meaning they weigh less than 5.5 pounds at birth. Then neonatal hypocalcemia. Vitamin D deficiency in the mother can lead to lower calcium levels in the newborn, potentially causing neonatal hypocalcemia. Now, hypocalcemia is lower calcium serum level in the newborns. Fetal growth restriction. Uh, we know that hypocalcemia is a condition that calcium is deficient in the newborns, and which can impact the heart as well later on. Fetal growth restriction, vitamin D deficiency has also been associated with fetal growth restriction, where the baby doesn't grow at a normal rate in the womb. Remember that one thing, that whatever the mom's vitamin D status is going to be fed to the babies through the placenta, through this mechanism, so that baby's blueprint is being formed during the pregnancy. And all the raw material which is provided by this hormone, which is the calcitriol, which is the active form of D, is through mom to the babies for making this blueprint of a baby. So all these growth factor element depends on the raw material which baby is receiving from mom's status. Increased risk of cesarean section. So in some cases, vitamin D deficiency can affect muscle strength, potentially increasing the risk of needing a C-section. Now, there was a separate study done that if somebody is deficient in vitamin D status, means mom, then there's a 93% chance of having a C-section rather than the normal delivery. So that's alarming as well. Recurrent miscarriages. Studies have indicated a potential link between the vitamin D deficiency and an increased risk of recurrent miscarriages. So that's very, very common, which we see around us. Impact on child development, which we have discussed earlier, that the ADHD issue and autism. Uh, some research suggests that possible connection between the lower vitamin D level during pregnancy has increased risk of these conditions in the childhood. Now, besides this, there are a slew of problems I have come across. I cannot condense everything in one vlog, but somebody was asking the other day, talking during our discussion at separate occasion, that eczema, of course, eczema, vitiligo, psoriasis in the babies or in the adults. This is linked to vitamin D deficiency. So if mom was deficient during the pregnancy, during the pregnancy, vitamin D deficiency was there, the chances are that, baby can have either of the, issue, particularly eczema or any other, elements, because, remember that, vitamin D is supplying all the raw material in proper formation of this blueprint of a baby in the placenta for the entire period of pregnancy. So this raw material is very, very crucial and important for the baby and the mom as well. Particularly after, if mom is going to lactate the baby, because whatever the mom's status is, whatever the mom's mother's milk is going to be providing adequate amount of D to the baby, and baby is going to form in the early formative years from child to 6 years of age for cognitive development and numerous things which baby develops after the birth. So important consideration here, supplementation. Vitamin D supplementation during pregnancy may help mitigate some of the risk associated with this deficiency, though more research is needed to determine optimal dosage and effectiveness. This is very well documented, and I've done many vlogs in different occasions that how you optimize your D level. If you haven't seen that, please, I humbly request you to see that, because this is the most crucial thing which I can attest to, for overall quality of life, for our existence. Because this is the only vitamin, I'm repeating myself, this is the only vitamin which nature has wired us in such a way that we can synthesize in our human body, okay? Provided we get exposed to the sunlight and we can have a bare skin, and the sunlight UVB rays gets in touch with our skin, and the 7-hydroxy, which is the cholesterol, it gets converted into the inactive form of vitamin D, which is, we call it 25-hydroxy, and then it has to be converted into through the process of activating the active form of 25-hydroxy through the liver, and then when it gets to the kidney, it gets processed and it converts into 1,25-dihydroxy, which we call it a hormone, which is known as calcitriol, which is the main hormone which provides all the raw material to the various functions, various cells at various genes levels in the human body. And this happens during the pregnancy as well, because baby is going to get that same vitamin D effect which mom has it. So mom's vitamin D status is very, very crucial from the day mom gets pregnant or conceives a baby. So it's very crucial. Now, I have a query that I did some research on this, that what happens during and after the pregnancy, or before the pregnancy and during the pregnancy. So let's take an example of a female before the pregnancy, before she conceived a baby. Of course, she has some kind of a vitamin D, if she's supplementing, or she has a vitamin D status. Now she is making that hormone, which is, we call it 1,25-dihydroxy vitamin D level, which is the hormone. So I made a query here, that is 1,25-dihydroxy vitamin D in women remains same before and during the pregnancy? The answer is no. Now try to understand this concept. So let's say if a female before she conceived the baby, she had a status of vitamin D, in her blood level, 25 hydroxy. And then she makes that hormone accordingly after processing through the kidney, 125 dihydroxy vitamin D. But once that same female becomes pregnant, her status of 125 hydroxy is going to be increased by as much as 50 to 100% as compared to before she was, before her pregnancy. It means that by design, nature has wired us in such a way that mom needs to amplify this effect of this hormone, because now mom is not a single, mom is two humans, right? Because mom has to feed the fetus as well. So it means that nature has wired us in such a way that mom's physiological demand is so high that that thing is going to be naturally amplified. So when mom becomes pregnant, this 125 dihydroxy gets amplified by nature, by with the physiological demand, because the physiology demands that that raw material needs to be provided to the fetus as well. So that's the key part here to understand. And I think mostly people misunderstand this thing, that why this simple vitamin D can be that crucial. Okay, so you need to understand how nature has wired us, because in the grand scheme of nature, the way he has wired humans, that there's a physiological demand, and that demand needs to be fulfilled. So once mom becomes pregnant, that 125 dihydroxy is going to get amplified, assuming that that's going to be given to the fetus. But that amplification only happens if the mom is adequate in the 25 hydroxy basic serum level in the blood to begin with. If there's not enough vitamin D in the blood level, of course that amplification is going to be done accordingly. It's not going to be adequate. So it's very crucial. Here are more details breakdown. Normal pregnancy 125 dihydroxy levels are significantly higher in pregnant women compared to non-pregnant women, because I already said that it's a physiological demand. The nature has wired us accordingly. Increased calcium absorption, because elevated levels of 125 dihydroxy contribute to increased calcium absorption in the mother, which is crucial for both maternal bone health and fetal skeleton development. Okay, so this is very crucial, because skeleton development is also part and parcel of this D status of a mom, right? Because that's how the fetus is going to be fed. Not solely due to calcium. While calcium is involved, the rise in 125 dihydroxy is not solely linked to calcium demand in early pregnancy, because it has multiple benefits as well, not because of only supplying the calcium to the fetus. So then I ask a question, that why mostly OB/GYN doctors are not, or general physician doctors are not emphasizing this vitamin D as such, as much as they should. Because if they are, if the scientific literature is out there, but the thing is that in this all the scientific advances, scientific advances in understanding the knowledge of vitamin D and how it impacts the overall human life has happened in the last 10 to 15 years. And mostly, if the doctors are not well trained, well educated in this scientific research oriented form, if they're being taught in school just for the bone health, that's how they're going to treat the patients as well. So I made this inquiry, that why doctors are not generally speaking on that. So this is the thing which I am getting various citations in the research. While doctors generally understand the importance of vitamin D for bone health, awareness and knowledge about its broader benefits and optimal management strategies can vary from doctor to doctor. Some studies indicate that that a significant portion of the doctors may have gaps in their knowledge regarding vitamin D deficiency, its causes, and its role in various health conditions. See what I'm saying? So basically, when they were in med school, they're trained basically that vitamin D is for bone health mostly. Okay, so it's going to prevent humans from rickets, from osteomalacia and stuff like that. It doesn't do more than that, because in the last 10-15 years, all these phenomena happen in the research, which is out there, which nobody is reading, nobody is keeping up. Of course, they have a little bit skepticism that they're advocating their patients as well. So here's the more detailed look. Bone health. Most doctors are aware of vitamin D crucial role in calcium absorption and its impact on bone health, including prevention of osteopenia or osteoporosis and fractures. They are aware of it, okay, but they are not aware of beyond that, because osteoporosis is again related to the bone health. Okay, beyond bone health, research suggests that vitamin D may play a role in various other health conditions, which we have been talking over and over, such as immune function. D is an immune modulator. Okay, remember that it's like a defense mechanism. You have a guard. If you have an adequate D, is as if you have a guard 24/7, 365 days a year around you. Okay, it's going to give you an immune boost, cardiovascular health, and even cancer survival. However, the extent of its benefit and optimal dosages are still being researched and debated. Now, this is something that I don't agree with it, because it's very well documented in various papers and periodicals that what are the optimal doses. Of course, the medical community is not having a consensus on it for whatever various reasons. Maybe pharmaceutical companies are putting a lid on it for whatever reason. But remember that as we've been talking about, that we are living in a knowledge society. We don't have to live in the current time. We have to live ahead of time. Okay, so I don't have 25, 30 years or 40 years when this is going to be a mandated thing by FDA, because I have this life and I have to take care of my life and my health now. So whatever the research is telling me, I have to look for that, assuming that, I'm a forward thinker. I'm looking ahead of my time and act accordingly. Because if we are living in a knowledge society, then the only thing we can do is learn, 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 and learn, okay, and improve ourselves. Because and investing in education is the only thing which we can do, which will reap the rewards in the years ahead. We will find out, because the dividends are so perpetual, not only in your life but your generations to come. Okay, so this is very important. I want you to understand this thing. Varied awareness. Studies have shown that a considerable number of doctors may not be fully aware of the nuances of vitamin D deficiency, its prevalence, and its management, including optimal supplementation strategies. No doctor is telling you that D needs to be taken with vitamin K2, because they are not educated. They are not updating their knowledge, because vitamin K2 itself is a confusion amongst doctors, because they relate to vitamin K, which is totally two different animals. Okay, K1 is totally different than K2, which I have talked many times in my vlogs. So there is a lack of understanding at that level, and sometimes some of us, including few of my good friends, they think that I have become a doctor. No, I'm not. I'm not a doctor by any means. I'm a educated consumer who keeps up with the knowledge. What's happening in the society, because this is what I control. And as far as the knowledge is concerned, I don't think the era we are living in, there is any monopoly on knowledge. Okay, information, knowledge, research, everything is on our fingertips. It's up to us how we use it to the best of our ability, and how we funnel that information, because information is frivolous on internet, on papers, on periodicals. But how you use your intellect in sifting through that information And through the credible sources, that's an art that needs to be perfected. I understand that. But who's going to do it? Only we can do it. Okay, nobody's going to hold us and tutor us. We have to take the initiative. And it's not easy. I'm not saying that it's very easy. It comes with time, but you have to take a first step. And that's what I'm trying to do through this series of vlog, to educate you that I was there at one point when I was completely ignorant. Okay, the moment I realized, I started reading and reading, I have improved huge, completely 180 degrees turn. Okay, it changed a lot of things in my life, not only in my life, my family's life. And that's what I'm doing. I'm sharing to the best of my ability to with other people as well. Continuing education. Now, here, this is the thing which I was talking about. There is a need for continued education and training for healthcare professionals to enhance their understanding of vitamin D and its implications for various health conditions. Individualized approach. It's important to note that vitamin D requirements can vary based on individual factors such as age, skin pigmentation, lifestyle, which doctors should consider and when advising the patients. Of course, I talked about it that vitamin D has many aspects how we metabolize. Not only skin pigmentation, but our body weight. Higher the BMI, the more we need. So you have to see, in totality of the picture that how this crucial hormone is figuring it out, how our health outcomes are going to be in future. So let me stop share here. This hormone is such an important thing. I've been saying for some 2 years now that if you want to fix something, the first step in fixing your health is fix your D status. That's all I can say. If you want to improve your quality of life, you have to understand that how this D works. If you fix this D thing and then subsequently you take care of other stuff, your lifestyle and other cofactors with it. But remember that, when you take D, make sure that, you take with vitamin K2, because, your D is going to increase your calcium absorption, and your calcium serum is going to spike a little bit. But if you are taking proper amount of K2, then that calcium will remain in check. Because a lot of doctors are telling you that you are going to get hypercalcemia, because it's going to be toxic, but that's not the case. I have done many vlogs and explaining you this issue, that they are not telling you to take vitamin D along with the cofactor vitamin K2. That's a must. K2 is another animal. It's a fat soluble vitamin just like D. So you have to see my other vlogs on vitamin K2, that how you should take it based on your individual genotype. So there are a lot of nuances involved in this. So you have to see in the totality of this grand scheme, that make sure that you see each vlog at your pace. I'm not asking you to finish in one sitting. Take your time, but make sure that you take notes and try to connect the dots in between and see the whole picture. Otherwise, you will miss the boat. Hopefully, see you next time.